early detection saves lives. You know, it's as simple as that. When you're talking about melanoma, the earliest melanoma, which is hopefully what we're finding, what we call melanoma in situ, is like so curable, almost 100%. I'm not going to say, because nothing is ever 100%, but almost that way. And so found early, it's like they saved their own life, or their husband saved their life, or their wife saved their life, or I saved their life because we found it early. Whereas if it's a late stage melanoma, I hate to even think about what it's going to be like when that patient has to sit down in the chair and I've got to tell them that they have melanoma, but it's at a stage where it's deep in the skin, and now we really have to get into action and do a lot of things that ultimately I know in the back of my mind all those things may not help because it's too late. We think that 90% of all skin cancers are caused by ultraviolet radiation, either the sun, tanning salon, something of that nature. We try to think that all skin cancers are treatable. Sometimes basal cells, even though they're maybe the least serious of the three groups, can be near an eye or an ear or the nose. And unfortunately, if it's neglected and the cells have spread locally, it can result in someone actually having to lose their eye or their ear or a good portion of their nose. So they can be quite serious, but usually basal cell carcinoma does not spread to another part of the body. Squamous cell carcinoma can start in an area, maybe the lip, the ear, a sun-exposed area, quite typically. It has the potential to spread to another part of the body. And we're seeing more squamous cells nowadays because patients are having organ transplants. Some patients get a kidney transplant, a heart transplant, a lung transplant, and they have to be on immunosuppressive medication so that they don't reject their organ. And that medication is causing more squamous cells to originate in the skin, and we have to be surveillant. Melanoma, the most serious, has the potential to metastasize. And what we mean by that is it starts typically in the skin, but if it's not detected early, it has the ability to go into the blood vessels or go into the lymphatics and actually go to an area way beyond where it originates. Sometimes, unfortunately, into the brain, the liver, the lungs, the bones. Sometimes it can cost someone their life because it spreads. We have some little guidelines. They're called the A, B, C, D, E of melanoma. A stands for asymmetry. So if you look at a pigmented lesion and you kind of draw a line right down the middle of it, if the left side and the right side are not exact mirror images, we begin to worry a bit about that mole. The B stands for border, if the border is irregular. C stands for color. If there's a panoply of color, multicolored, not just an even tan or an even brown. D stands for diameter. Typically, a mole, we want it to be under the size of a pencil eraser. If it's larger, we think that maybe that could be problematic. And we have the letter E now, stands for evolving, because evolving is an important one if there's change. If you have a mole that was always looking one way and now it morphs and is suddenly changing, looking very different, E would be a warning sign. For my patients that are at high risk, I really believe very strongly that if they can be imaged and we can capture what their moles look like and have a baseline of what they look like in one time and place, and then as time goes on, perhaps a year later, re-image, and we have the technology to pick up the most subtle change, I think it's fantastic.